Hello, everyone. Thanks for joining us today, and welcome to another webinar of our Taking Cost Out of Healthcare series presented by DSSI, a direct supply company. We're here today to talk about a new tool that we recently launched called DSSI Analyze. We launched this product in collaboration with our good friends at JBH Consulting, who are industry leaders in food nutrition services consulting. My name is Tom Swapp. I lead market development for DSSI. And prior to my role here at DSSI, I worked in the purchase services consulting space, working with health systems across the country, trying to help them wrangle their very complex service contracts. As I looked at the space broadly, I felt that there were insufficient tools that allowed health systems to manage at the contract level. There were a lot of companies that were aggregating AP spend by category and giving benchmark savings, but there was not a tool that allowed you to look at all of the inputs and outputs of complex service contracts. So 18 months ago, we embarked upon solving this puzzle with our friends at JBH Consulting. And today we're going to have a conversation with two people that have been very instrumental in developing this tool. We're going to get a chance to talk to Brian Berger, Managing Principal at JBH Consulting, and Nate Ziarek, Senior Product Manager at DSSI. Brian was instrumental in providing guidance from his decades of experience in negotiating these and managing these complex contracts. And Nate, who's been involved in building this tool from the ground up. He's led product design and development for the DSSI Analyze tool. So Brian, if you'll join me, I'd like to get you a chance to introduce yourself more formally and tell us a little bit more about JBH.
Thanks, Tom. Great to see you, and happy to be here. So just a quick background on JBH Advisory Group. My partner, Lynn Jagopi, and I started it back in 2009. Prior to that, we ran a global food and beverage advisory practice at PricewaterhouseCoopers for over a decade. At JBH, we've worked with over 450 healthcare facilities, really solely in support services, food and nutrition, environmental services or housekeeping, facilities management, patient transport, et cetera.
Awesome. Thanks, Brian. I'm glad you're here with us today. We've been working on this for a long time, so this is exciting. Can you tell us a little bit more? You mentioned, JBH Advisory Group and the partnership that you have with Lynn and some of your experience with PwC. Walk me through kind of what led to you all leaving PwC and starting your own thing. I think it's pretty admirable.
Absolutely. At JBH, we work in many segments besides healthcare, really with restaurants, hotels, convenience stores, really everything to do with food and nutrition and support services. We started in healthcare back in 2005 with PwC and partnered with their healthcare group to really initially look at food and nutrition within the acute sector. And what we really saw is, there was a lot of work being done from a benchmark perspective, but we take an operational approach where we really come from the operation side of the industry. And there's so many variables within food and nutrition and housekeeping and support services that you really need people that have a lot of experience running those departments, being directors, managers, to understand that side of it, as well as the financial and in many cases, the outsourced contractual side of it. So we decided to leave PwC so that we could really build up a team of operational experts.
That's awesome. I, from my days in consulting, I think that when people hear the word consultant, there's kind of this natural fear of, what are they going to come in and do? And I know that I think it seemed like there was always a tendency, especially in the services space, to push outsourcing as a consultant. You'd always hear consultants come in and say, well, it's easy. Like we can save you a ton of money just by outsourcing this. Can you talk through how maybe your approach is a little bit different and how you don't, hit the easy button and try and push outsourcing in every scenario?
Absolutely. I think for us, when we first entered into healthcare, what we saw was it's very difficult to really look at data and understand the true operational achievement of a support services department because of the nature of it. We have different volumes that are going on in regards to budget compared to what is actually happening. We don't work in a vacuum. We have new units that are opening. We have new scope of services that are requested. So really it's ever changing. Our approach is really to gather the data to understand the needed scope of services for that individual facility, to really analyze the business and then give our clients a true look at how they're operating, how they're performing, and give them options. For some, outsourcing may be the correct option. For others, self-operated is getting the results and achieving what they need to achieve. So it's really going into each scenario open-minded and using the data and using our operational know-how to understand how they're operating and giving our clients really all the information to make informed decisions.
I think that's, we've worked a lot together in the past on various client projects. And I think that's one of the things that always drew me in about JBH's process is that, there's no preconceived notions going into any particular client about what the outcome is going to be. It's really taking an objective look and using the data. There's a lot of companies out there that claim benchmarking, by looking at AP spend and whatnot. And for one health system, outsourcing may make sense, or being self-operated, or maybe even a mix of both. I know we worked at a specific client where there was half of them were outsourced, half the hospitals within a system were outsourced, and half of them were self-op. And I think, sometimes the decision at the end of the day is not to push one model or the other, but it's really to create internal benchmarks and figure out how one hospital, regardless of the operating model, is operating against another and kind of manage to that. Can you talk a little bit about the importance within JBH of normalizing data and creating true benchmarks, not just some swaggy AP spend benchmarks?
Absolutely. I think when we look at normalization, you can take two facilities within a health system, one outsourced, one self-operated, and they may be looking at information very differently. So for instance, from a cost of goods sold standpoint, a lot of our clients will transfer out costs to other departments for things like floor stocks and catering and doctors' lounges. So if we're comparing one cost of goods sold that has transferred those items out to another facility where they're included, you're going to get very different results. So we have spent, over a decade really making sure that we normalize data correctly, that each of the cost line items, things like management labor, do they include the clinical dietitian labor or do they not? And we have always gone through each line item, made sure we're normalizing in the same fashion so that we have the same costs included before doing that comparison. And then additionally, we know that there's volume adjustments. If you're just looking at a straight dollar amount, but we've for that cost of goods sold for our patient services, and we've served 2,000 more patients than we had budgeted, you're not going to get a true result. So by looking at metrics for per patient day or per adjusted patient day or per cleanable square feet, that's how we can really compare data fairly and have a true look from an operations perspective.
Yeah, it's I think your approach is proven as we've worked together. It's a very different approach to the way you look at the world. And obviously, we built this tool together, but there had to have been tools that existed, and I would imagine some massive spreadsheets that were kind of powering your operations prior to this. Can you walk us through some of the tools that you all have created?
Absolutely.
In lead up to this, release of DSSI Analyze?
Absolutely. Back in 2005 when we worked with our first hospital system, we saw that there's a lot of information that really doesn't integrate or speak to each other. So, there may be a financial accounting system like Lawson or EPSI where you're seeing really what's occurring, but you're not getting a true look. Additionally, that system may not have all the backup labor information where we can look at paid hours versus worked hours, where we can see paid FTEs versus worked FTEs, overtime, temporary labor. There is quality metrics that are coming in through a survey tool like Prescani. There are, information at the unit level where we're tracking what we're putting into floor stocks or tracking what we're doing with caterings. And you're never really going to get it in one spot. So we created tools at JBH to bring everything together so we can really analyze the business effectively. About 5 years ago, we turned those tools to be client-facing to help clients really monitor their business. In an outsourced perspective, a lot of times contracts, what is contracted and the guarantees and the triggers in the contract will not be realized in your financial system. So we bring that all together, and that was really the legacy tool that became DSSI Analyze.
That's awesome. I think that you talk about all the different technical systems that come into play and all the different variations of data that are coming into play that make it very difficult to manage these. And I think that one of the things that I mentioned is as we've done this, that it's very, very difficult to pull all that together. And I think that's why nobody is necessarily doing it. And when you talk about benchmarking at kind of the facility level, it's a very, very difficult thing to do. One of the reasons I was drawn to DSSI, quite frankly, and kind of my transition out of consulting over to working for this technology company is their ability to get into the weeds and manage at the line item level. Can you tell us a little bit about, how JBH came in contact with DSSI and what that was like, as far as forming that partnership?
Absolutely. We're very fortunate. We had a colleague at PwC that introduced us to a senior executive at DSSI over a decade ago. And that executive invited us out to come meet with you in Milwaukee, and we were really impressed from day one, especially from a technology standpoint. JBH, we're not a technology company, we're an advisory company and an operations company. And so we had, created tools to help ourselves, but we're really Excel based and did not have the ability to be a cloud-based user-friendly system. So as we made it client-facing, we approached DSSI because we knew with their history, the ability to have the developers on the team, 30 plus years in healthcare, having technology that's already operating in over 12,000 healthcare facilities. It was a perfect match. You know how to integrate, how to host. We can provide that operational level. But we truly needed a technology partner, and even more importantly, a technology partner that understands healthcare.
For sure. And it's probably a good idea to kind of jump into the tool and talk about what the tool is. At its core, when we're talking about DSSI Analyze, what DSSI Analyze is, it was built on industry experience, like you mentioned, all the work that JBH has done over the years, and it aggregates each and every dollar of your organization's purchase services spend so that you can find the insights and deliver savings to the bottom line. At its heart, that's what we tried to do when we built DSSI Analyze, and there's been a lot of people that have participated in the building of that. I mentioned Nate Ziarek early on. I'd like to bring Nate and Brian both back up on stage. And Nate has been such a big piece of this, and it's been many months in the making as product manager for this. Nate, can you kind of walk us through, like 18 months ago, like what was the genesis of this conversation and how did this even come to be?
Yeah, absolutely. Well, thanks for having me. Really excited to be here and talk about kind of all the cool stuff that we're doing in DSSI Analyze. 18 months ago when we started this, we kind of had the mission of JBH had these incredible tools, and Brian talks about them being Excel-based and not cloud-based, but they were truly incredible tools. They were able to drive a lot of insights from them. And we want to try to take all of the information and the experience that really were represented within those tools and find a way to apply DSSI's tech to them. So I heard you earlier mention some of our cloud infrastructure, our ability to do integrations, really take all of that technology to bear into a new tool that would allow the same level of insights that JBH was always driving, along with the ability to automate some of that and keep that kind of going as we went. Real quick, because we talk a lot about the insights, I think one of the big benefits that we often overlook is that with this new integration into DSSI, it no longer being an Excel file, we now have the ability to get this information to anybody, anywhere, anytime. It is a website that anybody can go to. You can, we don't have user fees, but anybody can get to it at any time. And, it allows you up and down your organization to be able to feed the data to the right people to, again, kind of drive those insights and then drive the answers to those insights.
I think we talk a lot about kind of like bringing all of these operational and data pieces together for one place. I think it's probably good to jump into the tool here. So I'm going to let you and Brian kind of jump on the demo and start walking through and tell us a little bit more about the actual product itself.
For sure. Hey, Brian.
Good to see you.
So I just mentioned that kind of available to anyone, anywhere. Can you just talk a little bit about your experience, before Analyze, how people were getting access to this data or didn't have any access to it?
It's really interesting because we see communication about these departments can be quite difficult. In an outsourced, situation, some of the costs sit on the vendor's ledger, others sit on the facilities. a lot of times those conversations, just getting the facility and the outsourced vendor to agree upon the data is challenging. Additionally, really at a facility level, leadership may not really understand all the nuances of these departments and understand, they may look at their costs and they're $100,000 over budget and they get very concerned. But the truth of the matter is they may have, had a much more population that they're feeding and they're providing services for. So there's a revenue component to that. So being able to dissect that information and present that true look operationally is been very difficult in the past. Everyone's reading from a different script. So as Tom had mentioned, I think Analyze is the first tool within the industry that can really bring the information together and then provide a translation.
You just mentioned the outsourcer contracts, and I think one of the most powerful parts of Analyze is, and I talked about it a little bit earlier, is that automation, that ability to integrate and get that data kind of sent to us on a feed on a kind of recurring basis. When we first worked on some of those outsourcer contracts, I can remember working on these and we modeled them all out in Excel so we could really understand what the contracts were and what the data we needed to be able to feed them. And I still kind of have night terrors about the idea of changing one of those cells, adding a row, adding a column, because the formulas were so complex. Those contracts can be very complicated, and every time we kind of modeled something out, you could see why. And I think you mentioned this earlier. People kind of don't monitor these maybe the way that they should because of that complexity. It's so difficult to do. I wanted to quick jump over into our contract tool here, a screenshot of that. And if you could just kind of talk to us a little bit about, again, we felt that pain in modeling those Excel files out. Just kind of talk a little bit about what people are doing with these today and how this tool really helps them.
Absolutely. As you said, each contract that we look at it is a little bit different. Many have guarantees that are associated to the contract. Many have volume adjustments. For instance, if we feed additional patients, there may be a variable rate that we pay to a vendor. So, we pay them $7 a day for each patient day above what that budget is. There's pieces within these contracts that you would never see in your financial system. So I think that, one of the really main amazing pieces of Analyze is all those calculations are done true to that individual facility's contract terms behind the scenes. So if we have a cost of goods sold guarantee that has some of those triggers for volumes where we're paying a vendor for a patient day or for our retail revenues, depending if we're above or below budget, there may be an adjustment for that guarantee. Those calculations are built in. So in a real-time fashion, we can see for a guarantee whether or not an outsourced company is below or above that budget once it's been normalized. And it's great for the outsourced company too. Everyone knows how they're operating according to a guarantee, which in today's world is very difficult to come by. Usually what people are doing is creating Excel spreadsheets, getting a snapshot in time, and then they have to continuously update the information, redo it, and they have to do it for each contract. It becomes a pretty tedious, difficult task to keep in real time.
Yeah, absolutely. And I think you said we become kind of that trusted third party here. We can take that data, integrate it all together, and show you kind of a real-time view of that. So we're in the tool now. I want to jump over to the overview page. This is one of my kind of favorite screens. It's very simple, I think, but I love the heat map view of it and how it kind of drives this instant insight into where you want to focus. So if you are in charge of your food and nutrition cost centers across the organization, you can see right here that Gala Infirmary and the Zestar Eastern Hospital, these are maybe some places you might want to focus on.
It's a great tool for leadership, and leadership can be confident that the information was normalized in the same manner. So we know that all of the costs were included for each of the individual facilities, whether they're outsourced or self-operated. We know that we're looking at a denominator of patient days, for instance, on the food and nutrition side, or cleanable square feet on the environmental services side. So that we're able to normalize the information based on the volumes that were there. So leadership can rest assured they're getting a true diagnostic look at where to focus. But the tool is actually made for not only leadership, but also to drill down so that our department managers and directors can use the information to make operational changes to affect their business.
Absolutely. And speaking kind of that normalization, I think, one of the things that Analyze does is a lot of that data manipulation. And you mentioned it earlier with Tom, things like being able to fold those transfers to floor stock and doctors' lounges back in. And the normalization, being able to divide, the environmental here by cleanable square foot, all these things that Analyze does that give you just a truer picture of that spend. And I think none of our screens kind of really demo that as well as our cost of goods sold report. So I want to jump over into this one because this is really a really good screen that really shows how we are folding together a number of different pieces of data. So all of our spend and expense data comes into here. Some manual data can come in here for like those floor stocks and those transfers, and then as well as that census data to get us that per patient day number. I really think that this screen really kind of pulls it all together in a way that really shows you the power of Analyze.
Absolutely, Nate. It's amazing what over the last 15 years, what we would have to go through to pull this information from all the various reports. So to be able to get our average check, going over to our point of sale system and having to run those reports, getting our census information for inpatient days and outpatient days. It's amazing to be able to bring it all together, be able to look, past fiscal years, past months, look at different time periods and still get the information. And what's really interesting is with the ability to break down this information and use it in an operational fashion. So, most times we'll see within a financial system one line item that just says product cost or cost of goods sold. Doesn't give us a lot of clarity into that information. So really what you can see, we can break down by retail, usage item, patient cost, really getting into the information we need in order to be able to drive our business, be able to speak to leadership about our catering costs being above where they should be. That may be a fine decision, but at least we have that transparency.
Yeah, those hospital catering costs seem way out of whack.
Not that's right.
So, we very much just kind of, I think, brush the surface of what DSSI Analyze can do. We did not get into things like the quality metrics you mentioned to Tom, things like labor, revenue. We've only looked at the food and nutrition, not the environmental and facilities management. But I think what we've talked about here really gives us a really strong overview of the tool and what the tool is designed to do to drive those insights and give you very quick recognition of the areas that need your attention.
Absolutely. At JBH, we've saved our clients over $750 million, and we've used this exact type of tool in order to do so. It's bringing that information together to truly understand your business. That's, our approach to being able to drive operational results. It's all about having the actual data that you need and looking at it in a normalized fashion.
Yeah, absolutely.
That's awesome. Thanks, guys. It's good to see this tool finally come to fruition. It feels like it's been in the works for a long time. And I know I've been on demos where this goes a lot longer. There's probably a ton more features and functionality that we could probably highlight on this. But thanks for the overview. It's great. For those joining us today, we'd love to be able to have a conversation. We feel like this is a very worthwhile endeavor. Being able to really highlight those opportunities for hospitals to be able to save money. So, if you are so inclined, please fill out the form that is going to be on the landing page. We'd love to have a conversation with you about your organization and find ways that we can help you take cost out of your own health system. So until next time, please reach out to us and we'll talk to you later. Thanks. Bye.